So we're really excited about some of the data that we're presenting. Obviously the strategy that we've had at BMS has been to focus on patients with challenging aspects of hepatitis C. And we have a couple presentations here that we're really excited to share with the field. One of which is the Ally 3 Plus program. The Ally 3 Plus program is looking at patients who are genotype 3 with advanced liver disease. They are being treated with either declatosphere, encephalophovir, and ribavirin for either 12 or 16 weeks. It gives us an opportunity to look at this advanced patient population to see how they do. And what we found was 100% of the F3 patients achieved SVR12, and the patients who are the cirrhotics also had nice responses. And the safety profile was consistent with what we've seen in our development program. So, it offers a nice piece of data to bring forward for the challenging patient population that otherwise, to date, we had not been able to provide data. So we're quite excited to share it. While it's exciting to see that result, I think that, at the moment, HCV has been moving at a rapid pace. And I'd say that the results that we saw in the Ally 3 Plus program offer clinicians more data to understand how to approach patients with advanced liver disease. The genotype 3 patient population, as many know, is a difficult to treat patient population. And the Ally 3 Plus data, I think, really offers them additional insight how to treat with either the addition of ribavirin or perhaps for an extended treatment duration. Genotype 3 patient population, what you find is that they're at a higher risk of progression of disease. And most of the therapies to date had really kind of given a lower response rate. For the cirrhotic patient population in particular, it's always been challenging when you have someone with advanced disease. I would say our approach and our strategy for the genotype 3 patient was to really evaluate how they performed utilizing the addition of ribavirin or the extended duration to 16 weeks. And what we've found is that, particularly for the F3s, the 100% response rate was quite exciting to see, and then the consistent results that we also started to see in the cirrhotics was also very reassuring. So we had a large compassionate use program across Europe, one of which was based in France as well. And what we found in those data sets is that we actually have data that is consistent with what we saw in the development program, but also focused on patients with advanced disease. So, for example, we have data that is looking at patients with decompensated cirrhosis. We have patients who are HIV co-infected. We also have some patients who are post-transplant. And what you find is that we have a nice response in those patients being treated with declatosphere soft and in some cases ribavirin. When we look to our future, we were very excited to share some of the data that we have coming forward from our dual program that was based in China. And what we find is that in that study, we're really bringing forward the first all-oral regimen data and from phase 3 data into the program, and it allows us to share and hopefully move forward with a filing in China as well. So when you look in the China 036 data, the dual data, it's looking at declatosphere and isonaprovir for 24-week treatment duration. When you look at the wild-type patient population, you actually see a 99% response rate for their SVR12. So that's very reassuring. Clearly, the genotype 1b patient population is extensive in China, and we are very happy to share this data and hope to move forward with having it working with regulatory authorities in China as well to make it available to patients in China in the future. China we see as a huge unmet need. There's a large number of patients with hepatitis C there, and frankly, we're excited to share that data here at AASLD and hope to move forward with a filing in the future to care for patients with Hep C. Part of our strategy at BMS has always been to look at patients and provide drug to patients where they have areas of unmet need. And clearly China, with over 10 million patients affected by hepatitis C, the data that we're sharing here is really the first step towards potentially providing that data to the health authorities and having it be there. I think China offers a huge opportunity for us, and we're hopeful to be one of the first all-oral regimens in China in the future. We are always actively working to provide access to patients, and I think that's not just based here in the U.S. We're also looking around the world to figure out opportunities to work with health authorities, to work with government reimbursement, and also even exploring opportunities to find ways to get drug to patient and on all avenues. I'd say from here, what we're excited to think about is where we can potentially evaluate other options for people with advanced disease. So clearly our strategy focused on advanced disease offers us additional opportunities to do research in co-infected patient population, transplant patient population, etc. We have nice results already, but I'd say that in our future we'll continue to look at patients with advanced disease and really shift our focus to Pacific Rim, because there is such a large, extensive patient population in Pacific Rim, and we're hopeful to provide the clinza-based therapy for them and bring them an all-oral regimen at this point.